Hi, welcome, good afternoon. I guess the others might join as they move along with their day's work. So we will start our webinar. So welcome, I'm Marifu Caballero and I co-chair the nutrition subgroup in the SIOP Europe Nursing Working Group. And Eugenia, who co-chairs it with me, is unable to attend and join us today, so we do apologize. Now, we've started this nutrition nugget some months ago, and we have now arrived at the 6th webinar, thanks to all our speakers. Today, we have the team from Princess Maxima Center in Utrecht, the Netherlands. And just so that people are aware, we have a parent speaker in that team. We welcome our special parent speaker guest. We never had parent speaker in these webinars before, so welcome. So just some house rules. So any questions, any queries, if you put it on the chat, we'll pick it up at the end of the presentation. And if you have more than one person under your login name in this meeting, just add the names into the chat. So we are aware, we have an estimate of how many people are joining these webinars. So without further ado, we shall hand over to the team in Princess Maxima. Thank you.
Good afternoon. Welcome to the 6th webinar, as Mary Jo already introduced. Thank you for that. Well, we are happy to have a new subject at this webinar, a very important subject to you, the Blenderized Tube Feeding and integrative medicine. And connected to the parents' wishes, we will discuss this topic. And my colleagues who will create this webinar are Margaret Achterberg, she's one of our dietitians, Miranda Dierselhuis, she is pediatric oncologist, and Antje Schenk, she is a parent, experienced mother with the Blenderized Tube Feeding. I will now give the word to Margaret, who will start this webinar.
Well, hello, everybody. My name is Margaret Achterberg. I'm a dietitian at Princess Maxima Center, and I will today take you into the subject of Blenderized tube feeding. So here are the speakers of today. And I'm curious how many of you have seen children or parents interested in Blenderized tube feeding? You can raise your hand. I see a few. Okay. And how many of you have seen children or parents who give their child Blenderized tube feeding? Okay, multiple hands. And how many of these Blenderized tube-fed children are supervised by a clinical dietitian? You can keep your hand raised if you do. Okay, nice. Well, Blenderized tube feeding, what is this? Well, it's actually whole foods blended into a smooth consistency, administered through a feeding tube. It's an alternative nutrition method for children who may not tolerate commercial formula, such as reflux, vomiting, stomach pain, discomfort, diarrhea, or if parents or patients prefer a diet of real foods or greater diversity of foods. Well, what's the evidence? Symptom improvement and clinical outcomes such as beneficial effects on gastrointestinal symptoms, less reflux, less retching, less diarrhea, reduced or discontinue medication previously necessary in managing upper GI symptoms, gastrointestinal symptoms. reduced respiratory urinary infections and anemia, and fewer hospital admissions, increased intestinal bacterial diversity. Some studies reported improvement in constipation. Others also reported worsening constipation. We see better clinical outcomes are reported. The nutritional content, that's a difficulty because the variations within blends, this may result in nutritional deficiency. A blended diet tends to provide a higher fiber intake than a standard tube feeding. So the pros to use blenderized tube feeding, we see a better tolerance, better fascias, less vomiting and reflux, also on social and emotional well-being, like you have a better connection with family meals. Sensory, patients are more likely to be open for new tastes and flavors after switching to home blenderized tube feeding. And then we also see increased oral intake, greater intake of nutrient diversity and fiber, and improvement in growth parameters. And important is it doesn't have to be all or nothing, so you don't have to only use blenderized tube feeding, but you can also combine it with a commercial formula. The possibilities are endless. The cons to using blenderized tube feeding, that's the nutritional adequacy. It's some evidence say it's adequate, and some evidence says it's adequate. So it's something you should look into. Also, food and hygiene safety, viscosity and tube blockage, a lack of support in hospital settings, poor availability when not at home, the costs, for instance, a blender, and also the time costs for a caregiver. And important is it's not appropriate for duodenal or jejunal feeds, because you need to give it in portions and not continuously. And it's also not appropriate for children under 1 year, because it's not. You need other things than just the blended diet, and the tube is too small to make it enough. You have different versions of blenderized tube feeding. You can use fully blenderized tube feeding. You can use partially blenderized tube feeding. There are also commercial tube feedings containing partial whole foods. In the Netherlands, we have HIP, or complete pediatric, in which a small part is whole foods. Then you also can choose for the homemade version, and slowly there are more options with already made blenderized tube feeding. In the Netherlands, we have Belly Food and Newly Blend, which are getting onto the market over here. In America, they have multiple versions, so slowly they're coming also to Europe. First step could also be to just use pureed baby food through a tube. Like the food and the veggies version. Studies show that also partially blended diet improves. What's important by implementing a blenderized tube feeding? Important is the communication with patients and parents about their wishes, and also the possibilities. It's important to involve a dietitian to make sure that an expert is taking care of, as told before, the nutritional adequacy and growth, the availability of needed materials, and of course, food safety and hygiene. Also important to discuss is the thickness of the tube. Blenderized tube feeding can only be given into the stomach, not by duodenal or jejunal tube feeding. And it's also important to have a backup plan. What if blenderized tube feeding is not available? What can we use then? When blenderized tube feeding, why is blenderized tube feeding important in pediatric oncology? Well, I feel like it's important to hear parents and their wishes. It's a request that parents can have. It's also something that in the first consultation of tube feeding is discussed with the dietitian to give it as an option. We see more scientific evidence, and within our center we have already the option of enteral formula tube feeding with food-derived ingredients. We have the Nestlé Complete Pediatric, and hopefully in future we will have more options and maybe a daily blends that patients can use over here. Needed supplies. A gastric tube, at least Charrière 10 of thickness, a weighing scale, a blender, preferably 1000 watts, a sieve. Also important is a spare gastric tube, syringes, and or a tube feeding pump system with containers, clean cooking area, and maybe a pan or other kitchen materials when cooking, and storage materials to store your homemade blends. I've written down a few helpful advices with blended diets. Well, it's the best way to make a good blend is by a strong blender. We advise the Vitamix or the Maggi Mix, which has a watt of over 1000. Make sure you strain preferably twice the blends, so there are no big pieces left in the blends. Test a new blend by using a spare feeding tube with the right thickness to see if the blend is going through the tube. Prepare more than one portion to blend it easier, and freeze the spare portion, spare blends per portion. If given by syringe, the smaller the syringe, the less resistance, the easier you can give the portion to the patients. And always flush the tube with water after giving BTF portion. Products advices: toasted bread blends easier than untoasted. Uncooked oat flakes blend better than cooked. Fruits without peel blend better. If you use dried fruits, it's easier to blend them if you have soaked them into water for a few hours. Instead of nuts or seeds, use a paste such as peanut butter or tahini. Cheese is more difficult to blend. You need more time to blend it well. Potatoes, pasta, and rice need more water added to it than couscous or sweet potato. And use liquid oils instead of solid fats because they will remain liquid after cooling down. Of course, there are multiple more advices, but for now, I'll give the word to Miranda.
Okay, thank you very much. So actually, in relation to this topic, I would like to talk a bit about integrative medicine, because I'm a pediatric oncologist, but besides that, I'm trained as an integrative medicine doctor and lifestyle. And it's not really shifting gear, and I will come to that later, why we think this is, well, part of a talk about a blended diet. But maybe first to have a bit of an outline, what do we mean by integrative medicine? And probably most of you have heard of CAM before, complementary alternative medicine. It's a lot of words on the slide, but actually it's what have been used over the last decades for all care which is different from what we are used to in our normal Western medicine practice. And it can be either complementary, so additional to the normal treatment, or it's really alternative, and which you have a variety of treatments you can give. And there is lots, most of the time, a strong opinion about these kind of treatments. And actually what we try to do with integrative medicine is that it's more like an holistic view on health. Use evidence which is available for different kind of mainly complementary treatments to in the end have an optimal health and healing of the patient. And if you look into a chart, you can see on the left side, you have in the upper circle, you have your conventional medicine. Then you have the complementary medicine and self-care, so things patients can do themselves. And right in the middle, there is this integrative health. And then if you look into the different domains which you can talk about in respect to pediatrics, of course, nutrition is a very important part of it, which is the topic of today. But also, for instance, sleep, but movement and exercise, but also mind-body connection, etc. Is important to it to have a view on all these domains and see how you can optimize health. Looking at different parts of it, actually, this is from the website of the NCCIH. So it's the American, you have the NIH, which is the National Institute of Health, and they have also a National Center of Complementary and Integrative Health, and you have different domains. And as you can see, that nutrition is a big part of it, and it's the diet themselves, but also dietary supplements, the use of pro or prebiotics, vitamins, some essential nutrients, everything is there. And you have the other domains like psychological and physical, which is not the topic of today. And while preparing this meeting, we were discussing, and Margaret asked me, so, but what are you discussing with parents who come to you and have questions? So most of the time when people come to me and I go into a consultation with them, many parents ask themselves just after diagnosis, and they hear about this disease which their children have. And of course, depending on the type of cancer, but most of the time it's a very long and intensive treatment they have to face. And they're asking themselves, oh, but what can we do ourselves? You tell me I have to take all these chemotherapies, other treatments. Is there something which we can do ourselves? As in also in the general community, diet at this point is important, and they are asking, okay, but are there certain diets we have to take? Is it beneficial to take some supplements? Are there herbs we can use, or do you think that alternative treatments might help my child? And not really that I do not want to give the chemo, but how can I have my child in the best optimal condition to go through this long process? And even more and more, we have like AI says that we have to do this or that this or that can be beneficial. What do you think about it? So then I kind of explain to them, just like I said to you, how we look at it in integrative medicine. So first of all, we ask ourselves the question: is there any evidence that a certain treatment or a certain supplement or whatsoever is really beneficial? And if it's so, because of course on the internet there are a lot of claims. Has it been really researched in children? And most of the time the answer is no. And if there is already research done in pediatrics. It's not always in pediatrics with children with cancer, or it's in adults with cancer. So we have to look at it on if there is evidence and what do we think about this evidence. So for many things, there is not a clear answer or a clear advice that they should really do go for. But what we can discuss with them is to focus on lifestyle. So if you have a look at again at the circle about all these things which are important in pediatric medicine, they are kind of the same as in the different lifestyle pillars, which is nutrition, but also, for instance, sleep, movement, and I try to discuss them what is feasible given the situation, because that also can differ from child to child. So because we know from extensive research that optimizing all these domains has an influence on your general health and condition, and therefore you can tolerate the treatment most of the time better. And if that in the end has a positive impact on survival, because of course that is what parents are aiming for, we don't know, but for sure it is to have to be as fit as possible during treatment helps and make the treatment a little bit easier. And therefore I also try to focus on physiology as much as possible when you can. And I think a blended diet, for instance, is one of these things, because you have the more normal food you're taking. You're not having continuous tube feeding over the night, because we have biologically circadian rhythm. So we have to sleep during the night, and our whole system is then going into kind of a sleep mode and is not used to digest food. And one other thing, which is maybe not really related to this, but I think is also important, is to reduce stress as much as possible, because that has many influences on your whole immune system and how you can tolerate everything. But that is, of course, more easily said than done when you're facing a child with having cancer. But actually, I'm not sure what Antje is going to talk about, but for most parents, when they know they can do something themselves, I was actually just talking to a mother this morning who is also giving her child a blended diet. She says we have to give away, and you are doing everything, but there are two things I can focus on myself, and one of these is mainly the diet. So I can have also a contribution into getting my child better, and also that helps to reduce stress for parents, that they kind of have a goal. Of course, she also said it's tricky, almost going into an obsession. That is not the right thing. But it can help you that you're really also, besides, of course, just giving the normal care to your child, but also playing a role in the treatment of your child. And then if there are certain things you are considering to use besides the treatment, I already talked about the evidence. We kind of have a decision-making tool to discuss with parents, okay, is this beneficial, yes or no? And you can see that here in the at the left side. So first of all, you have a look at, is the therapy effective? So is there evidence that there is a beneficial effect of this therapy? And the other question is the therapy safe? Also, therefore, sometimes there is no evidence, or we do not know. But if you combine those two, of course, when the therapy is effective and it's safe, you recommend the therapy. That is very clear. If the therapy is not effective, or it's unsure if it's effective because there is not much evidence, but if it's not safe, then we really discourage the therapy, because it's a potential harm for the child. If it's effective, but it's actually not safe, and to be honest, chemotherapy is in that area, because it's very effective, but it's also very toxic. We monitor it closely. So we take good care of our children, look at possible side effects, what we can see from the child or in the laboratory results. But most of the complementary medicine is actually in the right upper part. So we do not know if it's effective, but most of the time it's safe, so we can tolerate it. And especially when you have when we have questions about specific supplements or herbs, you can use a tool, for instance, about herbs, which is has been developed by Memorial Sloan Kettering from New York. But here in our center, we have a dedicated pharmacist who helps us to look for specific interactions when combining, for instance, when people have questions about mistletoe or black seed oil or curcuma, to see if there is no interaction with the chemotherapy or other medications the patient is getting, because many people do not realize that even though it's all herbal and neutral, that it still can have interactions with our the medicines we give to our children every day. So that's as a small side link to the topic of today. To have more like this is a part of an holistic health for the children, and I think even the most important thing is what is the experience of the patient. So therefore, I would like to give the floor to Antje.
Hello everyone, my name is Antje. I'm married to Jelle Schenk. We have 2 sons and 1 daughter. Our daughter Francine was born in April 2020. She was small for gestational age, and feeding and growth have been always a challenge from the start. At the age of 2, we began to additional feed her with 1 bottle of
Nutrini multi-fiber compact.
Yeah, each day. In May of 2023, when she was 3 years old, Francine was diagnosed with acute lymphoblastic leukemia. Tube feeding was started immediately in the first week. The first few months were difficult. She suffered from vomiting, stomach pain, diarrhea, and weight loss. Regular tube feeding and Pepti didn't help gain weight. We then switched to Neocate. With this formula, things slowly improved, and she gained weight, although she continued. Oh, sorry.
No, it's okay.
She continued to experience stomach pain and nausea. How we ended up on blended diet. I started research online and came across information about blended diet. I brought this to Margit, who was happy to support us. We begin with baby food jars from 4 months old. We diluted with water to the nasogastric tube, the Charriere 8. That went well. We then switched to the nasogastric tube Charriere 10, which allowed us to expand and blend the diet further. Currently, we give her 75% blended diet and food she eats herself, and 25% Neocate in the evening. What's important by blenderized tube feeding? It's important to have a pediatric dietitian who can guide you through the blended diet process. Having an app on your telephone to easily track meals, knowing what your child needs and knowing what your child needs. A powerful blender, a clean workspace, and a routine that allows you to prepare food quickly and efficiently are essential. The challenge that I face are it takes a lot of time to make good blends. Not all products blend well, which led to some food waste in the beginning. The food must be consumed within 2 hours. If Francine feels nauseous, it's not possible to give her within 2 hours her meal. This makes it difficult to get enough nutrition in. There isn't yet a feeding pump what is officially suitable for blended food. Hospitals are set up for blended diets. It's possible during hospital stays, but it means extra work for the patient, or for the parents. When going somewhere, you have to plan ahead for where to heat the food and clean your supplies. The effect of blended diet at Francine are less stomach pain, no more vomiting or nausea, no diarrhea or constipation, faster feeding times. As a result, she needs the feeding pump much less and has more freedom of movement. She also become more interested in food. She still eats little and gets full quickly, but she's starting to enjoy more types of food. What I want to share with you, providing a blended diet has worked well for us. Margaret has been incredibly helpful, thinking along with us in starting and maintaining the blended diet. I hope other parents who are interested in blended diet will also get the opportunity to try it. Thank you very much.
Ja. Links en rechts aan de rechterkant.
Kom maar, blijf zitten, want er komen vragen. Ja.
Thank you, Anja, for your sharing your experience. Thank you very much for the whole team. Is there any questions? If you want to pop the questions on or just on your cameras and unmute yourself. I have a question. So you mentioned just now tracking the calories and the food that Francine takes. Do you have a special app or you use the general one?
We have in the Netherlands from the government, from the feeding center app, the 8 meter.
It's a program that calculates all the nutritional intake.
Yeah, so it's actually the app that any general people in the population use, but not. Is it tailored for
pediatrics? For blenderized tube feeding.
Especially for blenderized tube
feeding.
It's
not.
Not, yeah. And it's for pediatrics?
No, it's for everybody. It's
everybody,
you can enter the age of a child, and then it recommends how many calories, but also how many fruits, veggies, everything a child needs from this age.
Okay. So no, that's exciting, isn't it? That you use the normal app.
The other thing is healthy children. That's true. Yeah.
Yeah. It's good also that actually you reported that Francine had less stomach pain, no diarrhea and constipation. So how about the weight? Has it been static? Has it maintained the weight?
The weight is still difficult. She gain better weight on the neocate feeding.
Yeah. So do you do some blenderized and also some high calories?
I do high calories in the blended with and I have two versions, one for the dinner and one for the lunch and the breakfast. And the breakfast and the lunch is the higher calorie, and the dinner is the normal because you have the potatoes and the rice that makes the blend thick.
Thick, yes.
Yeah.
It's not so easy to get it through.
Yeah. Okay, I'm just looking and see if there are any other questions in the chat. So can I also check with the team, the clinical? Oh yes, Ayla, do you wanted to come in, Ayla?
Yes, thank you. Oh, sorry, can you guys hear me?
Yes.
Yes, thank you so much.
Turn on your camera if you feel able to.
I don't have a camera on this computer. I'm
That's
so
fine,
sorry.
Ayla, carry on. Yeah.
Thank you all so much for sharing all of that. That was all very interesting. I just had a question around, so you said that you're able to support your blended tube feeds in hospital. In terms of kind of barriers currently that we've got with that is our infection control is quite, we find it really difficult to allow patients to do that on the ward just because of what they came to say about like infection risks at bedside and things like that. I was just wondering how you've gone about getting that through that process and if you have any tips on how to support that in other centres.
Yeah, here in the hospital, we are lucky to have two parents' kitchens. So the parents can use the kitchen to cook foods for the children, but also cook food for themselves, and they can use it as well to make blended diets. Yeah, that's a privilege, I guess.
Do you provide them with the equipment on, like, in the kitchen?
No,
or do they have to bring that in?
no,
They have to
not
bring
yet.
that in.
We're hoping in future, but for now they have to bring their own blender. We don't have the facilities in the kitchen yet to make the blended diet fully. So mainly the parents will bring their own mixer to blend the tube feeding, but they are able to cook at least the foods in the kitchen.
Thank you.
I have to.
Yeah.
I make blends at home and take it to the hospital.
Yeah.
Because we have also a shared care hospital, and there is not opportunity to cook. So I made the home, and they put it in the freezer, in their freezer, and then I have to ask for the food, and then I have to prepare it by myself and give it to Francine. It's difficult in the shared care.
Yeah, shared care is a hospital we work with our center, and also when you are here in daycare, because I was more talking about the children who are for a long stay in the hospital, but there are also children coming into daycare or going for a consultation with the oncologist, and they mostly bring their own portion of blenderized tube feeding. So you bring your own little package which freezes the feeding, and when you need to give it to her, you unfreeze it and then give it to Francine. So yeah, it takes a lot of effort to make sure you have everything arranged.
Yeah, it's good that you got determination and you got collaboration with the patient, Francine, and the mother, you, Anja, and the team. So I think that's good because it's about collaborative partnership, isn't it? To provide the optimal care for the patient. Can I just check with you as well? How many patients in the Princess Maxima has started something like this? Small numbers, maybe.
Maybe we were discussing it. The difficulty is we didn't track them yet. It's a main focus for, I think, the last year. It's a main focus thing of our hospital, so we are easier to track them from now on. But before we didn't. So I feel like around 6 are using it right now. A bit more, a bit less. Some use it during a shorter period and then going back to normal diet. So it's going up and down a bit. but I feel like 5 or 6 are using it daily.
Yeah. Well, I think it might be more, but they are not at this until now. They were a bit hesitant to discuss it with the dietitian, because when they first go to the dietitian and the dietitian is talking about food and only calories and tube feeding, and then okay, your child does not eat enough, okay, then we provide you with this tube feeding. They feel like there is not enough room to discuss that. Can we do it differently? And they just do their own thing on the internet. And Antje, she went to Margit and discussed it. But I think there are also many parents who just do not talk to the dietitian anymore, and they think, okay, I will arrange it myself and I will do it myself. So I think actually there are probably more patients than we know of.
Yeah, I feel so as well, and that's why we also, when we start with tube feeding with the children at our first consultation, it's already a subject. To at least open the subject. So if there is any interest in a later moment, if they want to start it right away, it's open for them to come to us. So we can also help them to feed their kid adequately.
And what do you expect for the near future, Margaret?
I feel like there will be more patients using it, also because we wanted to make sure that it's better arranged in our hospital, and they have also the information is right.
Yeah, more opportunity. Yeah. Okay.
Yeah, I think it's exciting. Now, can I just check with the tube? Is it a special brand that's more than 10 francs, is it? The measurement of the tube?
No.
It's not a special
No, it's not a special brand.
The tube. Yeah, how do you overcome the diameter of the tube for the blenderized food?
There were already recipes for tubes bigger than the 10. It were mostly recipes for 12 or 14, especially with the stomach, the Bechte. I'm not coming in.
The percutaneous gastric tube.
Yes, there were more options.
Yeah.
But our children in our hospital, they only have the nasogastrical tube. And this is a smaller tube because the children are not big. So you're not able for most children to put in a 12 or a 14 thickness. So, but it's also because we tried, you just made the blends, and we see that it's possible, that there are options. 8 is too small. You're not able to give everything that a child needs through an 8. You can still use partially the blenderized tube feeding, but fully is difficult because all the carbohydrates thicken and they will not go through well. But with a pen, we were able to feed her like perfectly what she needed. I calculated multiple times what Francine has been getting by the tube, and it was adequately. So yeah.
Yeah. Is there any special food that is more easily blended? So I'm just thinking about, I remember once in my years during BMT, there was a family who asked whether we can blenderize a pizza. You know, pizza? So, you know, are there categories of food that you would say avoid blenderizing?
I used, I prefer pure food, so as oats, sometimes bread, or quinoa, or sweet potato. Normal potatoes and rice, you blend it and you wait 5 minutes, and it is too thick.
Yeah.
And you add more water and more water and more water, and then it's not.
The amount is too big.
Yes. Sometimes it spends a lot.
Yes. Yeah. And
Because you want to get water.
Yeah, you want to get a texture that is liquid enough and yet thick enough, isn't it?
Yeah, and not too much pieces. Tiny pieces that go to the sieve are no problem. But if you use fruits with seeds in and a lot of
Yeah, lately we used a bread which had too big fibers in it.
Yes.
So if you have a bread in which the fibers are already made a bit smaller, it's easier also to use it through the tube instead of the big fibers.
Yeah.
But your question, like a pizza, of course, maybe you can try and add it. But we also wanted to feed the kid well. So
Yes.
yeah, we prefer the healthy
Natural foods. Yeah, natural food rather than processed food.
Yes.
That's the question that popped up because I remember the family asking about the pizza. So it's quite interesting that you're doing this now, and I'm sure in some other centers, although they don't have the facilities to promote it, there is this question that pops up, and it may be there's more of this practice than reported. Do you think that because you've advanced so much with this blenderized tube feeding, do you think that you'll do a comparison study to see maybe category or symptoms compared to weight gain?
We need numbers.
Yeah, of course we need numbers. Our first start was to get into the evidence that's already there, and there is no evidence about blenderized tube feeding within our population of children with pediatric cancer. There is no results within blenderized tube feeding at all. So yes, of course, that's not true. There's one, but it's not like a comparison of a normal blenderized tube feeding, freshly made, and a commercial tube feeding. Also not blind, but it's also a difficult thing to do. Yeah, these questions pop up, and hopefully in future we will have the possibilities. But for now, we didn't start anything yet.
No, I think it is difficult to do research on that because there's the balance of calories, and also the fact that actually by using blenderized food, do we then ensure the microbiome in the gut remains better in a better condition than if it's enteral feeding, isn't it? Because there's a lot of talk about microbiome in the gut, and
and that evidence is there.
Yes.
With
so I think that is one of the points that is, so what I said, so focus on physiology. So that is what's, it's more natural to have portions and to have the natural foods instead of the processed tube feeding. And as Margaret said, we did not do any research, but what and you probably also, and actually that is also what you said, you hear back from parents which are chemotherapy wise still in the same regimen, but they changed their food from the normal tube feeding to the blended diet. And for instance, the problems with diarrhea, they dramatically diminished and they got normal stools. And also most of these patients, they start eating again themselves better when they are on this tube feeding. Of course, these are very small numbers and it's just only some experiences, but I really think that it might be difficult to really have a randomized trial, but at least I think we should gather all the experiences to discuss this.
I think the trial will be difficult because but you know what, if you report these experiences as anecdotal, reporting it, publishing it, creates the environment for discussion and further trying the method. I think it's quite exciting.
We will within the 2 years.
Yes. If you report you say you've got 6 of them, and if you report on the cases with the parameters like the weight, the symptoms, diarrhea, vomiting, and things like that, that at least there is some data, although they are not quantitative.
You can use an historical control group, so that's also possible.
Yes. So I'm just looking at the chat now. Are there any more questions? If you are interested to explore this in your centers, you could communicate with Bianca's team. We can reach out to Bianca's team via Chiara, who's from SIOP Europe. You can communicate that way via email. Okay. So I wish to thank the speakers for this session. And just to remind you to look out for more in the webinar series. We've just finished the 6th in the webinar series. And if you could then do your survey, there's this QR code that if you could scan it and complete your form, and if you can make suggestions of any topics you would like to hear under this series, we could organize it. So that's the link there if you wish to click on the link if it's easier for you. Thank you very much to our parent speaker as well and to the team in Princess Maxima. You do wonderful work there. Thank you very much. And thanks for sharing.
Thank you for the opportunity, Mary Jo.
Yeah, no, I mean, it's really exciting. You've done 2 in the series now, Princess Maxima. We're going to have a competition. It's well done. Yeah, well done. Thank you very much. And you do marvelous discussion group because it's multiple presenters. So thank you very much. So just to share with you, our next, so that's the QR code for giving feedback and suggestions for other topics. But also our next session, we haven't confirmed the date yet, but it may be on the 30th September. And we are looking into nutrition in palliative care. The title might change. The speaker is away on study leave, so she can't confirm yet. But we will send more information via Chiara. Okay. I thank you very much for participation, and I will end this session here now. Thank you.